typical cold and flu seasons. COVID-19 is not going away anytime soon. As this disease, deadly to certain individuals, makes its way through our community, we must hold strong and all continue to abide by social distancing guidelines to help minimize COVID-19's impacts. At the same time, we must also ensure that we don't further damage our economy and continue to support our businesses that are abiding by social distancing guidelines. Your Emergency Operations Center remains activated to support coordination, information sharing, and provide logistics for our partners involved in the response to COVID-19. We continue to obtain and distribute critical personal protective equipment to our first responders and certain healthcare facilities. Testing. Last week, we opened up an appointment-based drive-through testing site that is now accepting individuals of any age with any one of the COVID-19 symptoms, fever, cough, or shortness of breath. This testing site has been an amazing public-private partnership that up to this point has involved Flagler County Fire Rescue and Emergency Management, the Flagler County Sheriff's Office, Daytona State College, the Florida Department of Health in Flagler, Advent Health Palm Coast, and volunteers organized by Flagler Volunteer Services. We can't thank these partners enough for making this site possible. As of this morning, the site has conducted almost 200 tests and will continue testing through Friday. We will pause testing from Saturday through Tuesday as we reconfigure the site to increase capacity further in an expanded partnership with Advent Health. More information on this exciting news will be available soon. This testing remains just one of many options that include your primary healthcare provider, the Advent Health drive-up testing site at Daytona International Speedway, the Florida Department of Health Flagler at their Bunnell location, and at various urgent care centers. Please visit www.flaglercounty.org/emergency, then follow the COVID-19 links and look for screening and testing for more details on how to obtain information for each of these options. Businesses. According to the modeling provided by the Institute of Health Metrics and Evaluation, Florida has already reached its peak for COVID-19 hospital resource needs and is expected to see a decline in demand for these types of services as it relates to COVID-19. It is important to note that while this is a good sign, it does not mean we are out of the woods, as the model assumes that social distancing measures remain in place through at least June 1st. Also, if individually and as a community, we don't take steps to protect our most at-risk groups, those 65 and older, and those with weakened immune systems, the demand for these services will quickly increase and have an effect on the healthcare system for all of us. Now that evidence is mounting that the virus causing COVID-19 can be spread by people without symptoms, I implore any currently open businesses and those of you that will begin to open soon to require both your employees and customers to wear cloth face coverings and maintain 6 foot or greater social distancing when interacting with others, including coworkers. Please help us protect our entire community. This sort of compliance is one of the most important factors in keeping the spread of COVID-19 manageable so that our community and economy can continue to reopen and head towards our new normal. Now is not the time to let our guard down. We must hold strong and ensure strict application of social distancing and cloth face covering coverage usage when interacting with others for the foreseeable future. We'll talk now about our parks and beaches. As you may already be aware, due to then current public health guidance, we close our parks and beaches to further social distancing and discourage out-of-town visitors from crowding our recreational facilities. A lot has changed since we implemented those closures, to include evolving public health guidance, improved understanding of social distancing by our community, and our ability to see the outcome of beach openings in other communities. Therefore, building upon the Governor's Safer at Home order that exempts certain recreational activities, last week we started trial openings of certain county parks with trails and have been monitoring social distancing compliance. Building upon the compliance that has been observed at these locations and following consultation with public health, municipal, and law enforcement partners, yesterday, Emergency Order 2020-06 was signed authorizing Flagler County and its beachfront municipalities to have a similar trial for limited beach reopenings that begun at 7 o'clock this morning. This trial is specific to recreational activities on the beach during the approved times that promote individual or household physical and mental health and not socialization, such as walking, biking, surfing, and fishing. Again, this is not for group gatherings. The entire beach will be open from 7 a.m. to 10 a.m. daily, and the areas outside of the city of Flagler Beach will have additional authorized evening hours from 6 p.m. to 8 p.m. daily. We intend to monitor the beach, just like our parks, for social distancing compliance, and depending on the outcome of that monitoring, we will modify the openings at both our parks and beaches. Even with the aforementioned openings, users must abide by CDC social distancing guidelines at all times and limit their activities to those mentioned. Specific details can be found on the press release posted at www.flaglercounty.org. Please remember that your actions do make a difference. We all must abide by the Safer at Home order, wear cloth face coverings when around others, and follow CDC guidance. If you have any public health questions, please call the Florida Health COVID-19 hotline at 866-779-6121. If you have any government services questions or unmet needs, please contact the Flagler County Emergency Operations Center at 386-313-4200 between the hours of 8 a.m. and 5 p.m. Monday through Friday. Or even better, visit our website at www.flaglercounty.org and follow the links for COVID-19. For our latest updates, please follow Flagler EOC, one word, on Facebook, Twitter, and Instagram. And I can't say it enough, thank you to our governmental and private sector partners, especially our first responders and healthcare workers. And thank you to our entire community for being a part of the solution. Thank you all.
I would now like to introduce Bob Snyder, who is Florida Department of Health Flagler Administrator, and then we'll wrap up with County Administrator Jerry Cameron.
Thank you, Julie. This is a beach community. It was inevitable that we opened Flagler Beach to our community, but only with a public health focus and reflective of a joint decision by city, county, health department, and law enforcement leaders. We cannot ignore the reality of decisions around us by Duval, St. Johns, and Volusia County to open up their beaches. So I'm a realist and wanted the public health perspective to be part of the solution. The plan that we are announcing is well thought out. It will detail hours for restricted access, stress adherence to social distancing measures, and emphasize that access is for physical and mental health activities only. Exercising, not socializing. Walking, biking, fishing, not congregating like under normal times. Residents are expected to keep their distance and or keep moving. This decision will be enforced by sheriff deputies and Flagler Beach police. If folks do not comply, the decision will be reversed. Public health recommendations, input from the community, and consensus by civic leaders are all behind this decision. In my opinion, it is okay to change strategies and response to this unprecedented public health crisis as long as health and safety of our residents are priority. I'd like to communicate now just 3 brief public health messages. As Jonathan mentioned, since last week, testing has increased in our area at the Speedway, the urgent care centers, AZA Health, the health department, Centra Care facilities, and now closer to home as he mentioned, at the Daytona State College Palm Coast campus. 119 residents were tested last week, including healthcare workers, first responders, and persons with symptoms, underlying conditions, or those who are immunocompromised. We didn't test on Monday due to the weather, but yesterday 79 folks were tested. And he mentioned the wonderful partners that have pulled this off on behalf of our community. So as a result, our positive case count in Flagler County has increased to 78. The total number of lab test results recorded for Flagler County is now over 1,000 at 1,020. The next message has to do with the most vulnerable in our community for the virus, and that is our elderly in nursing homes, assisted living facilities, group homes for the developmentally disabled, and the many small congregate adult homes that we have here in Flagler County. Much is expected of the healthcare workers and caregivers caring for our seniors with chronic and serious health conditions. They are the true soldiers on the ground, and the health department has been focused on supporting them since early March. Starting tomorrow, 6 teams of 2, led by public health nurses, will call upon all 71 facilities and review a checklist, document findings, and ensure that restrictive visitation policies are working, that both residents and staff are being screened daily for COVID-19. Also, we will review infection control practices, social distancing measures, and affirm that we are all on the same page in response to positive cases. These visits are an enhancement to our continued efforts. As of today, I'm proud to report that there are 0 positive cases of a resident in Flagler County. However, there are 2 staff members with the Flagler County residents who work at a facility in another county. In addition to daily testing at the Department of Health, a small army of disease detectives, specifically our nursing team, other staff, and volunteers, are spending many hours a day performing our most important task at this stage of our response to the pandemic. The strategy is called contact tracing. This is how it works. Once a patient tests positive for coronavirus, their close contacts, such as family members, colleagues, friends, or healthcare workers, are identified and provided guidance about getting tested, self-isolating, and watching for symptoms. Our goal is to connect with a close contact within 24 hours. This epidemiological investigation work is very labor-intensive but meaningful and effective in reducing the spread of the virus. Several school health nurses and medical assistants are among the volunteers assisting us, and are we forever grateful. Thank you all. Lastly, please go to www.floridahealthcovid19.gov for obtaining data, statistics on cases, lab tests statewide, and by county, city, and zip code. This information is updated twice a day. Thank you very much.
And now I'll hear from County Administrator Jerry Cameron. And I've got a quick message from Flagler Beach Police Department Chief Matt Downey, who's at the beach. He says people are being both appreciative and respectful, so glad to see it.
Thank you, Julie, and thank you to all the people that have made this technology available so that we can communicate with our community. And lastly, thank you to the vast majority of our citizens who have been supportive and participative in trying to do everything that will help us contain this disease. This particular disease is best described, I think, by a quote from Jordan Peterson, which I will paraphrase, and that is, what we have yet to learn is more important than what we now know. And that pretty much summarizes this. As we've tried to respond to a new virus that has characteristics that are in many ways very unlike past epidemics that we have addressed, we have had to constantly adapt to information that was coming in as the research progressed on this. When this first started off, there was a assisted living facility in Washington State, and the population was very vulnerable. A very virulent strain got into that population, and it appeared that the death rate was going to be very, very high for anyone contracting this disease. We have since found out that it is truly a dangerous disease for those who are vulnerable to it. But there is a vast number of people, the majority of the people in our society, that don't appear to have that vulnerability. We're still doing research to try to understand that. Consequently, the protocols that we used based on the information we initially had may not be appropriate to our policies that we develop. One of the worst things that we can do as leaders is to double down on policy that we made on information that is no longer the most current. And in light of that, we have determined that outdoor, at distances greater than 6 feet, there doesn't appear to be a great danger. And consequently, we have emphasized and educated that to our community, and our community has complied overwhelmingly. As we opened our trails and some of our parks and boat ramps initially, we have observed almost total compliance. As you just heard, the reports coming back from the beach today, opening up on a limited basis, there is a very high level of compliance. There's no one that can argue that being able to get out in fresh air, sunshine, is good for your mind as well as your body. And consequently, we anticipate that if this experiment goes the way we believe it will go, then we will be able to relax additional restrictions and maybe tighten up on some of the things that we know are harmful. The compliance of our community, the continued compliance, is essential for us to continue to relax the provisions that we have in place for public safety and health. We are on the doorstep of returning to normal, or at least the new normal. There are some things that will happen as a result of this that will change the way we do business for a long time. One of the things that we want to be prepared for when we start to open our businesses, which is imperative. If we kill our economy, we are going to be in a serious situation. The very character of our community depends on the mom and pop organizations and restaurants and things that make Flagler County what it is. Those businesses are suffering, and we have to take measures to see if we can bring them back online. I expect the state to be making imminent announcements to relax some of the provisions that they have in place, and our businesses need to be ready for that. We will educate them. If they will use face coverings and they will self-enforce on social distancing, we will be able to return to our previous normal situation much faster. I implore all businesses to please work with our health department and work with our emergency management office in order to comply and to allow us to continue to relax regulations so that we can once again be a Flagler community that moves freely. I appreciate the support that we've received. The vast amount of our citizens have been extremely supportive, and I ask those that have not been supportive to doubt a little of their own infallibility, because these decisions are not made lightly. We work on them all day long. Thank you again. God bless and stay healthy.
Reporters who have questions can raise their hand, and I'll ask our participants to kind of be at the ready. We do have one Facebook question from one of our first responders who asked a question about antibody testing, so I'll have Bob Snyder address that first.
In the future, we certainly hope that antibody testing, what we call surveillance testing, becomes available en masse in Flagler County and, quite frankly, around the state and around the nation. This is being talked about at the federal level, at the state level. We know that there are hospitals who have the ability right now to do antibody testing. We do not at the Public Health Department at this point in time. But we know that these tests, these rapid tests, are being manufactured, and the plan is to distribute them as quickly as we can around the country. The reason why these antibody tests are real important is because, number one, Mr. Cameron mentioned, and Jonathan did as well, that there's a significant percentage of our population that are asymptomatic, and they have the virus. So the antibody test, a valid antibody test, by the way, will identify who's had the disease, what is the extent of spread in the community, who had it 3 to 4 weeks ago. They're no longer contagious. There's even talk, and studies being done about using people's plasma who have the antibodies to help treat those in the ICU who are very, very sick. So there's an awful lot of benefits coming down the pike relative to the use of the antibody testing. We yearn for that day to arrive as soon as possible so that we can do this en masse in our community. And the results of the antibody test will help us make these decisions about opening up the economy and businesses in a smart way.
It does not appear that we have any Zoom questions from reporters, so at this point we will close this press conference. Again, thank you very much for joining us. Bye-bye.